It's a personality thing, right? Sometimes you fall into similar personalities. I think in dealing with children, the kids pick up on everything. There are no secrets with them. In fact, when I'm doing a procedure, sometimes a child's doing really well, and I'll just for a second start talking to the parent about something else, right? We'll talk about the debate that was on TV the night before, or the football game. The children get a little bit more wiggly. You have to very much be in the moment with children, and they pick up on if you're with them or if your mind is somewhere else. And one of the things that I love about pediatrics in general is the children are pure. They want to do a good job for you. They want to show their parents and you that, look what I can do. I'm a big kid. I can earn whatever I'm about to earn. And there's something to be said. They come with so much less baggage than some of the adults. I have to make sure that I don't create any baggage. And so that challenge, that artistic ability to deal with their behavior is what pediatric dentistry is truly about. The philosophy behind KinderSmiles is twofold. Not only do we want your children to have a cavity-free life, or even if they have some small issues to take care of, we also want to keep a really close eye on their dental development. The transition from seeing a dentist to seeing an orthodontist doesn't begin with a consultation every once in a while. It's something that we do every time a patient comes in, seeing the way their growth is going, any habits. Kids that are sucking their thumb or on the pacifier for too long have issues with their mouth, or certainly with their bite, that can cause other things to happen. It sort of snowballs. A little bit of tooth in an incorrect position can turn into a much bigger problem down the road. So every time a patient comes in, it's one of the main things we're looking at. And having Dr. Schulhoff, our orthodontist here, is a huge plus. We get to not only throw our brains together and make sure that we're doing the right thing for each patient, but we get to treat early things and small things before they kind of snowball into bigger things. The philosophy of KinderSmiles is to combine not only cavity-free people, but making sure that we're doing early intervention for any orthodontic issues that might come up. There are some children that can't get through certain procedures, right? Either because they're too young, or they have a very strong gag reflex, or there's always that child that has a super stuffy nose all the time, and when you try to give them a little bit of laughing gas, it's just not going to work. They're not going to be able to breathe it. There are situations where a child has too many cavities, and they're just not going to be able to sit through it in the regular dental environment. And if we put them through that, we'll have put them through a ridiculous ordeal, either having to strap them up or do something that is really uncomfortable. It's certainly not something that we would want to do here. We need to come up with a better way. We need to do something that will get them through these dental procedures, but not force them to go through something that's almost impossible for them to handle. For those children, we have general anesthesia options where we can do all of the dentistry all at once with them asleep. I often call it hitting the reset button. I tell a parent, yes, this child has a lot of cavities. There might be baby tooth root canals or things that people that aren't in the dental field don't even know are procedures that you'd have to do on children. But we can do it. We're going to do it all at once. We'll take the x-rays. We'll do everything that this child needs to go through in an environment where they're sleeping, they wake up, and all of their teeth are done. We have hit the reset. We can start over. Their mouth is now cavity-free. The bad ones are either out or fixed, and we have created now a patient that just has to go through regular routine checkups. We keep an eye on the fillings through the years, and hopefully not have to put them through anything that they would not have been able to handle. And that's the great thing about having those options. Not every child can go through every procedure and be able to handle it like an all-star. Some kids need a little bit of extra help, and keeping that in mind and keeping the child's best interest in mind always makes us come up, or always allows us to come up with what's best for them and to make good decisions.